Thank you, everyone. I would like the audience to stay back and listen to the symposium on ENT more than academics. I would like to call upon Ashish Chikhlesa and Trupti Gadkare ma'am to chair this session. Now I would like to call upon stage Dr. Rahul Kulkarni to give a lecture on a novel standardized Proforma, a game changer for medico-legal cases in ENT.
Actually, we are late by 2 hours, so I'll take only 4 or 5 minutes, not more than that. So, I'm Dr. Rahul Kulkarni. So, my topic is novel standardized Proforma, a game changer for a medico-legal cases in ENT. By the way, why I have chosen this topic? So there are 3 medico-legal cases. I experienced, not myself all cases. There is one high-profile murder case, one arrest warrant against me, and one strangulation in an illicit relationship. Our profession is a noble profession, but Consumer Protection Act 86 and 95. Actually, we are not in a Consumer Protection Act, but damage has been done. Doctor-patient relationship has become quite strained. Focus is not only been treatment, now it is documentation also to safeguard ourselves against the medico-legal suits. So documentation is much needed, because if there is a not proper documentation, then we will invite legal complications. I'll talk about a strangulation case. Actually, my colleague experienced it. एक एक्स्ट्रा मरायटल अफेअरमध्ये फिमेलच्या हजबंड आल्यानंतर त्या माणसानी त्या फिमेलनी गोंधळ घालायला चालू केली आणि त्या झटापटीमध्ये तिचा त्या पर्सननी ना गळा दाबला, अशी ती स्टोरी आहे. सो दॅट female came to hospital and just told that she is feeling breathlessness and she has an injury mark on the neck. She never told the history, and after that she told that no, I want one day admission. So that newcomer doctor admitted her. He has written history also, and okay, so after one day everything was fine. But after 6 years, the doctor got a summons from the district court, and when he entered when he went to the court, actually first thing is problem is the remembrance of cases. That is the most important thing. So that doctor, welcomed by the opposite lawyer, he asked about what is contusion, what is abrasions, what are the marks, and everything he asked. So doctor innocently told everything, and he went into the interrogation box. That same lawyer screwed him like anything by asking, okay, what is the length, what is you have not mentioned the width of the injury, and what he told ki on a treatment on discharge you haven't signed also. So that type of question he asked, technically we never thought of and we never dreamt of. So in that case we need a proper documentation. What golden rule says, anything not documented did not happen, and any lack of information can lead to medico-legal negligence. What are the most common errors? It is a documentation of the size of injuries and poor description of the external trauma. So that is important. One more high profile murder case. During the goddess procession, there was a fight between 2 groups, and there was one death and one injury. So that injured patient came to the hospital. It was profusely bleeding. So, and he came with the 50-60 persons. So it was a very high voltage drama in the hospital. So he took in the operation theater. He stabilized the patient, and he had a nasal bone fracture, and after 2 days he reduced the fracture. But after 3-4 years, being very high profile murder case, there too many high profile people were involved. So first question, interrogator asked there is a lacunae in between the your papers and the police papers. There is a little discrimination in between two papers. So first question he asked, doctor, you have treated patient for the nasal bone reduction. Doctor told, yes, I reduction done. So is it due to the assault? Doctor told, oh yeah, it is due to the assault. But next prosecutor, that's opposite lawyer asked, is any chances that person fall and there is a nasal bone fracture? Answer is yes, it may be. What was the problem? Why he can't prove it is due to the trauma? Because there was a small incised wound that doctor didn't mention due to the high voltage people. And there was a difference between the police and his statement. So that small incised wound also you have to mention in the paper, but you know this situation how much is. What is a medico-legal case? So it is a case of injury where law enforcement people should fix the responsibility. So there is a fine line between the simple and grievous injury, but punishment is significantly different. So for that purpose, we Grand Medical College came up with a Proforma. I'll just run out. So this is a history. We have to say yes or no only. See, hearing loss, ear bleed, tinnitus, giddiness, ear discharge. So we made a Proforma for that: nasal bleed, external deformity, swelling over nose, foreign body, oral bleed, tooth loss, difficulty in glutination. So neck, these are the history. For a local examination, we made graphics also. So it is very easy and there is a very less chance of any error in that. So again, tracheal tenderness, mastoid. So detail you have to write yes or no. So for nose also, for neck also, we have the graphic presentation to minimize risk and errors about this. So this is the score. So time taken for a taken detailed history is around 20 minutes in the our casualty notes, and 10 minutes, it is 8 to 10 minutes, it is a Proforma. So it is a scar scoring system. It is maximum score is a 16, minimum score is a 0. So 1 is a unilateral hearing ear bleed, 2 point is a bilateral, 3 point is a unilateral hearing loss, 4 point is a bilateral hearing loss, nose bleed from one nostril for two nostril. So this is, but this is not correlate with a simple injury or any grievous injury, but it is important for our documentation and severity. So my important takeaway message, बराच वेळा सेकंड ओपिनियनला आपल्याकडे पेशंट येतात. मी बघतो, मी जेव्हा महाराष्ट्र मेडिकल काउन्सिलमध्ये जेव्हा केस टाकतात तर आपण एज्युकेट करतो पेशंटला, दॅट इज अ बेसिक प्रॉब्लेम. जेव्हा सेकंड ओपिनियनला पेशंट येतात तर कुठेतरी आपल्या बोलण्यातनं पहिल्याने असं केलं होतं किंवा असं काहीतरी येतं, तर इट इज माय सिन्सिअर रिक्वेस्ट, फर्स्ट टाईम जेव्हा पेशंट कुणाकडे प्रिव्हियसली जात असेल त्याच्यावर कमेंटच करू नका, आणि जरी केलं तरी एकच सांगा, त्यावेळेस ते बरोबर होतं. ते फार महत्त्वाचं. जे ज्या केसेस येत आहेत त्या केसेसमध्ये असं येतं की आपल्याकडनं इट मे नॉट बी डेलिबरेटली, पण चुकून असं लूज टॉक पण नाही असं म्हणणार, आपला रिमार्क जातो आणि त्याच्यावरनं ते स्टोरी बन, अरे पहिल्याचं हे चुकलं असेल. म्हणजे मी एका केसमध्ये बघितलं आता की काय मेन्शन केलं होतं त्यांनी 2 केसेसमध्ये, की डॉक्टर मी आज चेक करत होतो आणि डॉक्टरांना फोन आला आणि डॉक्टर व फोनवर बोलत होते. दुसऱ्या एका केस याहीपेक्षा, म्हणजे मी ही केस तर मला माहिती आहे, दुसऱ्या एका केसमध्ये तर असं आहे, डॉक्टर झी न्यूज बघत होते. तर नेहमी एकच लक्षात ठेवा की आपला सेकंड ओपिनियन केव्हा आपला कलिग्स असताना चुकूनही रिमार्क्स करू नका. दॅट इज ओनली माय मेसेज. अँड थँक यू ऑल ऑर्गनायझिंग कमिटी टू अलाउ मी टू टॉक.
Hello, sir, 1 second. Sir, I would like the chairperson Ashish Chikle sir to felicitate Dr. Rahul Kulkarni sir.
I would like to call upon Dr. Manthade sir to felicitate chairpersons. अच्छा पुढचा आहे. Okay, sir, Rahul Kulkarni sir, we want to felicitate you on behalf of our organizing team Medcon 2024 for being for being our MMC observer. I request Dr. Harkut Prasad, Dr. Borade. Sir, thank you for being with us as MMC observer. Thank you for your help and support.